So this is stressing me out again. So I'm just going to go back and I'm just going to run through some things that are happening out there in another world. I would say that one of the things that often I find difficult is that you come into my office and you say, why doesn't anyone know about lymphedema? Why aren't there people doing something about it? What are you doing something about it? And as a clinician, I feel I have to do something about this. But there are some things happening, and I'm just going to go very quickly, unlike the other talks, very quickly through what's happening. Oops, sorry. What have I done? That's it. Okay, so the Lymphedema Action Alliance started in 2013, and it was really came up from some activities that happened on the North Shore of Sydney, looking at problems that people had for lymphedema. And we've gradually collected together 20 organisations. These include the Cancer Council of New South Wales, Alert, the ALA, Country Women's Association, BCNA, and a number of the groups that are support groups actually through whole of Australia. And we're really concentrating on two actions. One is equitable access to quality lymphedema services, initially in New South Wales, but in other states they've taken on a number of the activities that we've done. And this particularly also includes that lymphedema services that are available in public hospitals, of which there is not a lot, should be actually available on their website so people can actually find out about them, because it's a big secret what's happening in the public health system. The other thing is really to have sustainable access to affordable lymph garments nationally, and you're going to have a talk a little bit about that. What has happened really from both work within the public health system in the health department, and also I think pushed along by the Lymphedema Action Alliance and a number of other organisations, has been that the previous Minister of Health asked the Agency of Clinical Innovation in the Chronic Care Network to look at lymphedema guidelines. And this guideline is now in the final version. It's approved, but in design stage, and we're hoping in the next weeks or months or years it will actually come to available. No, I think it's soon. So this is really a document that specifies principles of care for delivery, early intervention that we've talked about, quality care. It's a document that the goal is it's available for local health districts in New South Wales to improve and sometimes establish services, and it also will act as a self-assessment tool for those health services as they set it up. So these were the principles of lymphedema management in that document, and you can see those outlined. I think one of the important things for us, I guess for me in particular, was Principle 7, where we need to have in our public hospitals an ability to respond to people who are actually admitted with lymphedema or admitted with cellulitis. And they're often at the moment just discharged home without care. So there is some principles looking at that, and hopefully that will be a really important document that we can utilise as in advocacies in going to our health services later on as patients and saying, well, what's happening here? There is a guide for the care in hospitals. The Cancer Council of New South Wales, which is part of the LAA but has been a tremendous asset to us, has in fact now developing an election campaign for 2019, and part of that campaign is that they look at what are the advocacy focus for the Cancer Council. And this year, the Cancer Council one of their advocacies is supporting people with lymphedema. Okay, so that's a fantastic result for us. Really a lot of pressure actually put on them for and the Cancer Council now acknowledges this is so an important aspect because so many people are now surviving cancer for such a long time. So these are the other two, tobacco and kids not eating junk food, which is an important part of management of cancer because we know obesity and cancer is somehow related. Now, part of the advocacy is really that we need to get you to not only think of yourself as people, as patients, as all these sorts of things, but think of yourself as constituents. And constituents are really, really important when advocating because it's really important for you to go to your local members, to all the people who are going to try and get your vote and say, I'm a constituent and I have lymphedema and I want you to do something about that. The parliamentarians have a responsibility to respond to constituent complaints. So one of the things that the Cancer Council is, it's hoping to get as many for you to volunteer to give your stories about your experience of cancer-related lymphedema. They've been very, very good and been happy to accept all other cancers, lymphedema as well, but in this circumstances it's cancer-related lymphedema. And what's your experience of your management in the public hospitals, if you have any experience, or you're even good or bad, but that's what they want to have. Now, there was someone from Cancer Council, there, so this person, stand up. So she's here. So in the meantime, you can write out your questions, but if you could go and see Alex.
I've put some brochures on the desk just outside the lift too, if you want to pick one up. And there's also a postcard there that's an action for the campaign to reach. If you don't want to share your story, you can also support the campaign by adding a name.
So this is really important for us because this is a way you get some response. Now, moving on from that, one of the other things that we've been doing, both the LAA, or the Lymphedema Action Alliance, and the Australian Lymphology Association, is a submission to the Commonwealth Health Fund. This is an independent hospital pricing authority. These are authorities we didn't know about, you see. They actually set the cost of care that's provided by the Commonwealth to the state governments to look after people. So they work out how much it costs for a renal dialysis patient, or a person with a heart attack, or a person for this or that. And you know what wasn't on lymphedema? Well, it wasn't on this. Lymphedema wasn't mentioned. Or it was mentioned as a minor skin disorder. So the pricing that's been put on lymphedema has been extremely low, and this does have an effect on service availability in the public hospitals because of the pricing, the way budgets are run and so on. So what we've tried to do, they're doing a new public consultation on what's called non-admitted care, which is the outpatient treatments. And what we've done is we've tried to get lymphedema actually placed on the disease classification for circulatory systems. Now this puts us into wound care clinics or those sorts of things. It actually dissociates lymphedema from what was called the post-mastectomy syndrome, which was lymphedema syndrome, which was one classification, or minor skin disorder, which was the other. So what we've said is no, lymphedema is part of the circulation. It needs to be managed and classified in that way. So we've put that in. That moves slowly as well, but it's there. And finally, what we're also trying to do, and I'm going to be asking John to assist me in this, we're looking to apply to the MSAC, which is the Medical Services Advisory Committee, which is again a Commonwealth Government committee which appraises services for public funding under Medicare. And what we're trying to do is get the lymphedema complex, one-to-one complex lymphedema therapy to patients with lymphedema by a lymphedema practitioner, being funded to the extent of 10 extended sessions per year, and that's within the chronic care system. This is like your lymphedema network. This is like lymphedema congestion. There's so many different ways of going around this, but if this happens, it really falls into, your GP would say, as they do sometimes now, give you an allied health 5 sessions per year. We're asking that system to actually provide us with lymphedema therapy, but for an extended period for 10 sessions a year. Again, it's going to move slowly, but that's what we're advocating. So I just wanted to talk about things are happening. We really need your help. We really need your stories. We need to have you as constituents working. Therapists and doctors and so on, sometimes we're seen as partisan, but your stories are really, really important, and they do have an effect in advocacy. So that's finished. Thank you.